Hey guys, today I'm gonna talk a little bit about how the baby gets through mama's pelvis and what we can do in case baby gets stuck, which is called shoulder dystocia. It's very rare, but it does happen quite a bit, especially in hospitals when mamas are drugged and they are in the lithotomy position, which means they are laying flat on their back. So this is the base of the spine right here that connects down here to the sacrum, and here's the coccyx or the tailbone. These up here are our hip bones, iliac crests here at the top, which they have nothing to do with how your baby can get out. So if you have wide hips, it doesn't necessarily mean that the inlet, which is this hole that the baby first goes into, and the outlet, which is the second part where the baby comes out, are big enough. But most women have plenty of room in here, as well as ligaments and joints and moving parts. So our pelvises are not stationary, they're bones, but they're just like our other parts that have places where they can move. And just like right here, the sacrum can move back and forth to make more room for baby. The pubic symphysis up here is where the shoulder usually gets stuck, but not always. There can be different places. So let's say our baby is head down in a vertex position. This is the way that a baby usually goes through the pelvis. They will engage, which means their head will touch the pelvic floor and kind of lock into place here inside of the mother's pelvis. And then baby will descend, and in doing so, the chin will tuck up, called flexion. And then baby will rotate so that those shoulders can then fit snugly in that area right there. And some more extension will happen, and then external rotation or restitution, when the baby's head turns to go back in line with their shoulders, usually like that a little bit. And then the next phase is just expulsion. Baby comes out. So as we can see, baby kind of has to do this corkscrew movement to get through the pelvis. And sometimes that can be impeded when the shoulder of the baby gets stuck right here on the pubic symphysis bone. This can happen for a couple reasons, but the biggest reason is that mama may be on her back or not able to move around and help baby get into a better position to facilitate those movements. That would be maybe an epidural, or she's laying on her back in the lithotomy position, like I said before. So now we're going to go over some of the ways that we can help get the baby out of, unstuck from this spot right here, and just kind of the ways that we can do that. So the first thing that you want to try is, if mama isn't on her hands and knees already, to move her into that position, hands and knees. That will allow gravity to play a different part and usually result in the baby coming right out. If that doesn't work, you can also have mama put one of her legs up by her hands for a runner's lunge, and in doing so, that will open the outlet of the pelvis a little more on that side, the leg that's up, and that will also help baby have a little more room to come do their rotation and come out. If that doesn't work, we can flip mama onto her back and put both of her knees up as close as we can to her face, and that also opens up the outlet, and she kind of leans forward, which might help the coccyx and the sacrum go out a little bit more and have a little bit more room for baby to come through. If those don't work, you can also try a standing lunge, which is mama is standing and she'll put one leg up on a stool or something that's higher than what she's standing on and lunge into it, and that in turn will also open up that outlet on that side to help the baby come out. If all of those fail and mama doesn't have any positions that she intuitively wants to get into, then you will try to do some maneuvers with your hands. So the first one is the Woods corkscrew maneuver. So you would reach in. So this is mama's front, pubic symphysis, back. So we'll say that mama is hands and knees position. So we'll reach in for the posterior shoulder and the anterior shoulder, and the baby will go counterclockwise. And we will kind of push that shoulder for baby to do that rotation and come out. The next one is the Rubens maneuver. So in this one, it's just the opposite way. And sometimes if mama is on her back, there's also some suprapubic pressure given, which is when someone presses on that shoulder on mama's belly and gives it a little push to help facilitate that rotation. And with this one, it is the clockwise direction. So you would reach in for that posterior shoulder and the anterior shoulder and go clockwise with a suprapubic pressure if mama's on her back for the baby to come out. And then the praying hands maneuver is a midwifery maneuver, and that one is you reach in with your hand along the back and one hand along the chest, and then you would rotate whichever direction has the least amount of resistance so that baby can come on out. And then last is, of course, the last thing you ever want to try, because it is really awful. But if all else fails and baby is turning red, really dark purple in the head, and the baby needs oxygen, then sometimes in the hospital, doctors will break the clavicle. So you reach in for the posterior shoulder and you kind of hook the clavicle and pull it towards you. You don't want to push on it so that you avoid puncturing along. And you pull on it as hard as you can until you hear that crack. And when the bone cracks, there will be enough room for baby to come through. Bones heal relatively quickly in newborns, but hypoxia or lack of oxygen does not. So that's why, if everything else fails, that is what they recommend to do. Thanks for watching.